How does lethal injection lead to botched executions? Have you ever wondered how a method intended to be humane can sometimes lead to disastrous outcomes? Lethal injection is the most common execution method in the United States, but it is also the one most often linked to botched executions. A botched execution occurs when the process fails, causing unnecessary pain or suffering for the individual being executed. The lethal injection process involves administering a series of drugs. First, a drug is given to render the person unconscious. Next, a second drug paralyzes the body, and finally, a third drug is used to stop the heart. This method is designed to be quick and painless, but things can go wrong. One major factor contributing to botched executions is the lack of medical expertise among the staff performing the injections. Typically, prison personnel, who are not trained medical professionals, carry out these procedures. This can lead to mistakes, such as incorrectly inserting the needle, failing to locate a suitable vein, or administering the wrong dosage of drugs. Such errors can result in extreme pain or prolong the execution process. Another significant issue is the sourcing and use of the drugs. Many drugs used in lethal injections are actually intended for medical purposes, not for ending lives. Pharmaceutical companies often refuse to supply these drugs for executions, forcing prisons to seek alternative or illegal sources. As a result, the drugs may be expired, improperly stored, or used in untested combinations, which increases the risk of complications during the execution. When lethal injections go awry, the consequences can be horrific. The individual may remain conscious and experience intense pain, or they may suffer severe reactions like convulsions or vomiting. In some cases, the execution must be halted because the person is in obvious distress, yet they may still die from complications. There have even been instances where individuals survived the initial attempt and had to be executed again later. From a true crime and criminology perspective, botched lethal injections raise serious questions about the reliability and humanity of the death penalty. They highlight how even well-intentioned methods can fail, leading to suffering that resembles torture. These incidents are often documented in autopsy reports and eyewitness accounts, providing material for true crime analysis and discussions about the ethics and effectiveness of capital punishment. Understanding these cases can inform public debate, legal challenges, and policy changes regarding the death penalty. True crime content can use these facts to illustrate the real-world consequences of execution methods and engage audiences in discussions about justice, human rights, and the limits of state power.